In tonight's Health Watch, holiday season getting in high gear with excitement spreading for both children and adults.
But for people with Alzheimer's or dementia, the holidays can really be a difficult time. CBS 2's Dr. Max Gomez tells us they can even be a health risk. Doctor?
And I learned about this the hard way. My father loved the holidays, but when he developed Alzheimer's, the holidays became disorienting. For one thing, he didn't remember many of the relatives the rest of us look forward to seeing. It's a common problem for people with dementia. Here's how to keep those folks safe.
How the holidays, that wonderful time of year, family gatherings, lots of lights and beautiful decorations, endless shopping and round-the-clock carols. But for people with dementia, the very things that are the magic of the holidays can become very disorienting.
We forget that when we are changing the scenarios significantly and suddenly, it may be a lot for our patients with dementia to take on.
Any changes in routine can be very disruptive for people with dementia, so imagine what the holidays can be like. It took a few years, but the Cooper family eventually came to realize that the holidays had lost some of their meaning for their mother, Lorraine.
She's not always sure what time of year it is, so we have to remind her. So once you remind her, then it becomes a little bit more difficult.
They've learned how to adapt the holidays so as not to upset their mother.
We'll see a couple of people. We'll go to my cousin's house, and we'll have a celebratory dinner where there's a lot of family members.
Dr. Manisha Paralekar, chief of geriatrics at Hackensack University Hospital, says to keep gatherings smaller and less overwhelming. And it's also important that guests at family gatherings are aware that someone in the house has dementia.
Letting others know about the cognitive impairment, so the relatives or the other family members who are making the arrangements do count that in when they're making those plans.
That's especially important when it comes to alcohol at parties.
It may interfere with their medications, it may interfere with their behavior process, and sometimes not understanding the satiety could be a behavior symptom of dementia.
And even Lorraine has learned to adapt.
If I feel overwhelmed, then I walk out of the room.
Now, some people with dementia are wanderers, and at holiday parties with lots of people coming and going, it's easy to forget about Aunt Martha, who could then slip out an open door and get lost in the neighborhood. Consider leaving the alarm on the front door. And you know, you don't want to necessarily use this term, but it's almost like thinking about child-proofing the home, because really, folks with dementia have kind of reverted to that childlike state. So you have to be careful and protect them from themselves.
Something like this was such a great reminder, though, because I think a lot of families don't think that there is going to be a family member. If they are dealing with dementia, it's going to be a difficult time.
Any disruption in routine for people with dementia is tough. And so the holidays are especially tough.
Thank you, Dr. Max.
You bet.